Imagine dieting and exercising and never being able to get rid of the buildup of fat. It's actually a serious health condition many face called lipedema. Not only does it make people feel self-conscious, it's uncomfortable and sometimes even painful. Joining us today is a cosmetic surgeon and owner of Lipo Plastic Surgery, Dr. Thomas Su. Welcome to Bloom, Doctor.
Thank you. It's nice to be here.
Well, this is really interesting because I'm sure people have seen folks with lipedema but never realized that it is an actual health condition, and it's impossible to exercise or diet your way to losing that fat buildup, which the rest of us can do.
Right.
So what exactly is it?
Well, you know, it's great to be on here because I think the important thing to do is bring awareness that there is a medical problem underlying fat in patients who have this. The fat that we're talking about is lipedema. So lipedema is a condition that causes fat growth that accumulates disproportionately in areas, mostly affecting the lower legs, the upper thighs, and the arms. The women that you've been talking about, we've all seen women who have thicker fat around their lower legs. We call this cankles in many cases, where there's fat around the calf down to the ankles. It often appears as a cuff, a thickened area around the ankles. That's the classic look that we see with lipedema. And this fat is resistant to diet and exercise. It's not normal fat, it's diseased fat. And no matter what type of diet and exercise that patients try, they can lose weight in their torso, in their chest, back, and other areas, but they will not lose the fat that is the lipedema fat. So lipedema is a very common problem. In fact, it's suspected that about 1 in 11 women will actually have lipedema at some stage or another. This is a it's a progressive disorder that oftentimes affects women even in their teens and early 20s and just gets worse throughout life. So it affects women in 2 different ways. The first way being emotionally. I think early on, you know, the patients that I see often tell me that, you know, they're active physically, doing sports and other things, and they're the ones that always have the thicker legs. And it's a very emotionally traumatic type of problem because many of my patients tell me they will never wear shorts, they don't wear skirts or anything, and emotionally you can see how it'd be very difficult because these patients blame themselves. And nothing is improving with all the efforts that they put into it. Is it
hereditary? I mean, what causes lipedema?
I would say hereditary is the main cause, I mean, as far as we understand it, because we don't have a great understanding of lipedema. But yes, the patients that have lipedema oftentimes have sisters or mothers and other relatives who do have the same kind of fat patterns that they have.
Now, you specialize in surgery that helps alleviate this fat. How does that work?
Well, I treat patients every day now for lipedema, and lipedema is, there is conservative treatment for lipedema, which involves using compression garments, maybe dietary changes. At best, okay, so I need to back up a little bit. Besides the emotional component, there's a severe physical component that starts later on, involving pain and tenderness in these affected areas. So, you know, the experience of women is that if they have something that brushes their legs, or they're crossing their legs, if they have their children sitting on their laps, this is enough to cause pain, you know, that they can't tolerate. It also causes problems with achiness, heaviness, that prevents them from doing exercise. And these symptoms are something that patients start to believe is normal, but it's not normal. You know, no one should have painful fat. So the palliative measures with stockings or diet only partially alleviate some of the symptoms. It doesn't reverse the condition. So what I do, my specialty is cosmetic surgery, and especially in the field of liposuction. Liposuction, removing the fat, is the only cure.
Interesting. Doctor, I'm so glad that you joined us on Bloom today to shed light on this. And I know a lot of folks that might be suffering in silence. If you want more information, you can always visit artlipo.com. And we'll be back with more Bloom right after this.